Why is it that in the last 50 years, we've been able to eradicate smallpox, transplant a human heart, and unravel the entire DNA code, but we can't tell women whether or not they should take hormone replacement therapy or HRT when they go through menopause? That point in a woman's life when her ovaries mysteriously stop functioning and they no longer make these critical hormones, estrogen and progesterone. It should be a really simple matter. If our thyroid quits working, we go on thyroid hormone. If a man's testicles stop working, you can bet he's going to walk out of the doctor's office with a prescription for testosterone. But why we can't tell women whether or not they should take hormones has been a controversy for decades. And that's because the pendulum has swung back and forth regarding the benefits and the risks. For a long time, there was this notion that menopause was basically a normal life transition, something women should just grin and bear and not medicate like it was a disease. But then around the 1960s, oral estrogen became widely available. And thousands of women started taking it, and they said, this stuff is miraculous. It solved their hot flashes and other miserable symptoms. It made them feel better, look better, and even probably saved a lot of marriages. But then with more widespread use, some adverse events did start showing up. There was an increased risk of blood clots and an uptick in the number of uterine and breast cancers that were being diagnosed. Now, the uterine cancer was easily solved because we realized you had to take the progesterone drug with an estrogen drug, and that would prevent that. But the breast cancer issue was a little more alarming to a lot of women and their providers because that kind of gave estrogens the reputation of being a carcinogen. But at the same time, women who took hormones had far fewer hip fractures and spine fractures, that crumpled us over like this. And studies were showing that hormones were actually extremely beneficial for the heart. And so the question is, are the benefits for the heart and the bones more important than the risks for the blood clots and cancer? What we needed was a big gold standard kind of study to decide this. And so in 1991, the National Institute of Health launched this huge study called the Women's Health Initiative, or WHI. This was a massive endeavor. It cost millions of dollars, enrolled thousands of women, and was really run by a who's who list of menopause specialists across the United States. And the idea was to take this massive amount of women and put half of them on hormones and the other half on a placebo or sugar pill. And the idea was to follow these women for the course of the study and at the end assess how many good things and bad things happen. So we were all anxiously waiting for the results of this study. And in 2002, the results were published. And let me tell you, it was a bombshell in the field of women's health. Because unlike what we anticipated or expected, the conclusions were that hormone therapy caused more risks than benefits and should not be used for preventative therapy. They found a 26% increased risk in both heart attacks and breast cancer in the women who are on hormones, a 40% increased risk in strokes, a doubling of the risk of blood clots, and on top of that, women on hormones had more problems with urinary incontinence, dementia, and unbelievably, taking hormones did not improve their quality of life. The newspapers had a heyday with this. Honestly, there was all across the nation, hormones are hurting women. Doctors have been mistreating their menopause patients for years. You can imagine the chaos that happened. The phones here at Overlake and across doctors' offices everywhere were, ringing off the hooks. Women were confused and scared and didn't know what to do. The bottom line, the aftermath, was that thousands of women simply threw out their hormones and quit hormone therapy. And new guidelines came out. Basically, the guidelines said that women should not take hormone therapy unless they were having such severe symptoms that nothing else worked, like antidepressants or psychotherapy. And as physicians, we were to prescribe only the lowest dose for the shortest period of time. This WHI was a real blow to me because, first of all, I didn't like being accused by the media of poisoning all my patients all these years, because I had written hundreds of prescriptions. But on top of that, in 2002, guess what? I was going through menopause. I was having terrible hot flashes, and my nights were just awful. I'd wake up at one point throwing off the covers and burying my husband, or then going, to change my pajamas because I was all sweaty. Menopause, it was just affecting my sleep and my temperament. Let me give you a little bit of advice. If you have a woman physician and she's going through menopause, don't call her in the middle of the night with a question that could wait till the next day, because you're going to hear a side of her that isn't pretty. So for me, taking hormones was a no-brainer. But it wasn't just because I knew they would cure my hot flashes and help me sleep and make me my nice self again. I was more concerned about not having these guys in my body for the next 10 or 20 years of my life. Because I knew that the minute my hormone level went down, the little bone-eating Pac-Man cells in my bones called osteoclasts would start getting revved up, and they would eat my bones up at a rate 3 to 4 times faster than a man my age. I didn't like the idea of just hanging around and waiting until my bones were on the verge of a fracture before I would be a candidate for something like Fosamax. And I knew very well what was going to happen down there, that part of our anatomy we don't like to talk about. Without estrogens, I have done many pap smears and pelvic exams over my long career to tell you there is a huge difference between a 35-year-old vagina and a 65-year-old vagina that hasn't seen hormones for a while. The tissue is very thin, very dry, very delicate, makes any kind of activity down there uncomfortable, if you know what I mean. And it increases a woman's risk for not only vaginal infections, but bladder infections. And as an internist, I take care of a lot of heart patients. And I didn't want to do anything that was going to increase my risk of a heart attack. And I knew that without estrogens, my LDL, that's the bad cholesterol level, would go up. That's not good. But I also knew that without estrogens, there would be a much more increased risk of plaque developing on the lining of my arteries. Plaque is the stuff that builds up and causes blockages that lead to heart attacks and strokes. And finally, there's one other thing that maybe a lot of women are really not aware of that happens to our body when we lose estrogens at the time of menopause. We start putting on abdominal fat, that belly fat that we don't like. Now, it wasn't that I was vain and didn't want to see my waistline get bigger. Okay, there was a little bit of that. But I was more concerned that this belly fat is actually unhealthy fat. It increases your risk of cardiovascular problems and a condition called insulin resistance, which is a forerunner to diabetes. So for me, I thought hormone therapy was the right choice. But here I was in a dilemma because as a physician, we've been handed these new guidelines that basically discourage hormone therapy. What am I supposed to tell my patients? What am I supposed to do? What was it about this WHI study that led to these guidelines that made hormones look so bad? Well, there's some things women need to know about the WHI. First of all, the magnitude of the adverse events was grossly over-exaggerated. We heard, for instance, a 26% increase in breast cancer. Boy, that seems like a lot. What is that, 1 in 4 women or something going to get breast cancer? No. Of the 8,000 women who are on hormones, there were 7 more cases per year of breast cancer out of those 8,000. That's less than 1 in 1,000 risk. I hate to say this, but do you realize that's the same risk as drinking 1 glass of wine a day as far as increasing your risk of breast cancer? And the other thing about the WHI you should know is that had they used the hormones that we use today and recommend today, which are really essentially identical to our natural estrogen and progesterone, there would have been fewer adverse effects. Because the hormones they used in the 1990s for the WHI, which were the ones available, actually behave differently in our body. And certainly in the respect of the progesterone type drug, it was a synthetic progestin, not our natural progesterone. We know now that that actually can increase some adverse effects on the breasts and the arteries. But the most important thing that you need to know about the WHI is the age of the woman in the study. It wasn't age 50. That's when most women would go on hormones when they go through menopause. The average age was 63. That means that the majority of the women were over 60 and had gone 10 to 20 years without their hormones in their body. This age factor really has turned out to be the biggest issue about why the WHI came out with results that just seem so surprising. Because what we know now is that if women go for a long time, say 10 years or more, without hormones, and then we give them hormones, it's like the body doesn't recognize them and they don't do the same good things they used to. And in fact, they can do some negative things. So now we know that the outcome of hormone therapy really, really depends on when you start them. If you start them right at the time of menopause and just continue the hormones in your body, you actually have more benefits than risk. More benefits than risk. And this has been intensively looked at over the last 6 or 7 years. Researchers have gone and looked at thousands and thousands of women, in this age group, this 50 to 55 age group, and looked at their outcomes. They pulled them out of the studies done before the WHI, after the WHI, and even that relatively small group of women in the WHI who were actually in that age group. And they find that these women all had, consistently, the studies show a significant decrease of their risk of heart attack, strokes, and diabetes. Those are huge health risks. And as far as the breast cancer issue goes, taking hormones for up to 5 years really causes a negligible risk of breast cancer. Taking them longer than 5 years probably slightly increases the risk, but it may be only if you combine one of the synthetic progestins with your estrogen. So hearing these pretty impressive health results with early estrogen treatment, you may be surprised to know that only 5 to 10% of women today are on hormone replacement therapy. Why is that? Well, it's because doctors are following the guidelines, like we're supposed to. But the guidelines we have today are the guidelines that came to us in 2002 based on the WHI study. Now, hopefully if you've been listening, you should be saying, wasn't the WHI study a study of older women who had gone quite a while without their hormones? Yes, that is actually the problem we're facing today. What's happening is we're taking the results of the WHI, generalizing them, and applying them to all women, no matter what their age, and to all hormones, no matter what type. That simply is not appropriate. And experts in menopause across the globe agree and are advocating a much more liberal approach to hormone replacement therapy. They're trying to get the message across to women that while women are afraid to take HRT because they're worried it may harm them, The truth of the matter is that by not taking them, they may cause themselves more harm because they're missing out on some of these important health advantages that early estrogen provides. So that is why I want women to know before they say no to HRT. Thank you.